So we got Moses, Angel, and Danny.
Angel, Danny, and Moses. They were all three transporters when they were in the early 20s. I actually was health supervisor for a while, and they were transporters.
And I just remember them as little, I mean, they were kids. They were transporters. It might have even been their very first jobs. I don't know. And they were buddies. And through the years, grown up, they've gone to college. They've got their degrees. They're getting married and having kids.
My name is Moses Luis. I work in the Cath Lab, and I work in the Cath Lab recovery, and I'm a registered nurse.
My name is Danny Buhane. I work in the Cath Lab. I'm a radiology tech as a scrub.
My name is Angel Melendez. I am a cardiovascular / radiology tech, and I work in the Cath Lab.
I was a transporter for 9 years, so I definitely paid my dues and grateful for the opportunity and the blessing that I'm in right now. I tell these guys, like, remember those times? Like, those were like our college years, because we didn't go off to like these, big colleges. So those times of, that time, the era was our college years. We would hang out together, all that, have fun. My buddy Angel, a lot of people would say that him and I kind of look alike too. So we always call ourselves brothers, the Melendez Bros. But he's a homie, or he's a friend as well. Someone that I can rely on is, in the time of need, not just a coworker, like I said, just a true, genuine friend.
I think that's awesome to take three young kids, fresh out of school, and they're here working in a hospital and not knowing much, and working hard and going to school and getting educated and taking the next step. I think that's awesome, that we all achieved that.
Yeah, I was already like 19. I was 19 when I first started, so I was just a young kid here, and I still feel the same way. Worked as a transporter up until 2009.
I had no idea of the Cath Lab, even working in the hospital as a transporter.
Then I started radiology school, and during that time I worked with Moses, Angel, and we've created bonds just working together.
Danny at the time was in the radiology program, and I remember thinking, like, if this guy could be an x-ray tech, like, I could do it too.
So when I first got hired as a transporter, there was house transport, and we would transport all patients throughout the hospital except radiology. And this used to be all old radiology. You work in a hospital, it's like an interview. People see how hard you work, you want to work hard, and if managers, nurses, everyone that you come across and the bonds you make, it all adds into your credibility. And if you are a hard worker, team player, it shines through.
When I was a transporter, we took a lot of the patients that they did and took them up to the room. So I got to meet a lot of the staff, ask questions, see the type of work that they did, and then when I first became an RN, I worked on the floor for a while, and there was a position open, and I remember these guys, and I remember this type of work, so I went down, talked to them, worked some extra shifts, got my foot in the door with them, and then applied for the position, and they were willing to take me.
Yeah, it was nice just seeing the growth, not just in ourselves, but also the respect we've gotten from the techs and our peers that have been here before us.
It's awesome. I never imagined that I'd be in this position. If you asked me when I first started working here, I never thought that I'd be where I'm at now. To save someone's life, it's very intimidating, at least it was at first, and then you kind of get used to it and you get good at it, and then I know that I'm actually glad to be in that position because I feel like I'm good at what I do, and I love having the opportunity to get to save someone's life. I think that's very special.
Yeah, even just looking at the floor here and like pushing gurneys, looking down at the floor here, it's just like Moses said, brings back so many memories. Yeah. And it's like nostalgic. It just takes you back.
We all used to hang out, and, single, no kids, and now we're all married now, and some of us have kids. And I was actually born in this hospital, and seeing the growth. And also, I gave birth to my daughter and my son here as well. I'd say what I'm most proud of is being able to help save lives, and being able to be a part of that. And if it was my family member on the table, I treat every patient that way, and I want to take care of them.
One thing I hear from the patients is the staff is great, the staff is nice, everyone's so personable. I think I love that most about the hospital and the group here, is that it's real. The love is real. That's it. It's just the love here. It's bittersweet because when you walk these halls, like you get all these memories and emotions. Certain times. I remember right at this exact spot, something happened here or something happened there, and yeah. So it's bittersweet. It makes you miss the place, but you're grateful it's still here.
There was years where we kind of all went our separate ways as far as going to school and doing all that. It takes a lot, and to see us come back and work in the same place, I think that's like awesome. You don't see that a lot, and to still have that friendship, and like the guy said earlier, having so many great memories, and now we can continue that. Like I think that's special.
And now here they are, they're ours. We've given them, the place that I hope that they call home forever. And they're still friends, and they're still working together, but it's just in different roles. It's really inspirational.
They got each other's back for sure.
Knowing that looking to get into the Cath Lab, they were here before me, and knowing that I wanted to work with them again just because they're great people, and they make my job a lot easier, and just a joy to come in and work.
They're always a good time. We've had some good times outside of work as well, and top of that, I met my wife here, so that's the best relationship of all.
To be in the Cath Lab, and I feel like I'm a strong believer in everything happens for a reason, and I feel like I fell into the medical field and fell into the Cath Lab for a reason, and I couldn't be happier to be able to serve my community, and I'm proud of that.
I worked in the hospital coming up on 15 years this December.
I first started working here in 2011.
I worked at CMH for 14 years.
And we started from the bottom and worked our way up.